Thank you, everyone, and I am really thrilled to have so many participants today. Some of them I recognize, and also colleagues from other agencies. Yes. So first, this is a webinar that WHO is providing as part of the massive online course that Basel Convention, International Telecommunications Union, several universities, NGOs, WHO, UNEP, many other agencies have put together on electronic waste. So this is, again, as I was mentioning about this online course, this is the third pillar. And I think the beauty of this is it really reflects on how this is a problem that we all need to work on and solve together. And so there is not just one issue here. Health is one of the issues, and some of the solutions and the issues lie with many other actors and many other agencies and many other groups than health. So this massive online course has 5 pillars, and the one that we'll be focusing on today, and this is a bit of an aperitif, is the one on health, and particularly child health. And I invite you all to go to the massive online course itself, because you will have there much more details than I will be able to give today. So you can also watch the video from the director of our department and many other directors of other agencies encouraging you to take this course. So my name is Marie-Noëlle Brune-Dries, and I work on children's environmental health in the Department of Environment, Climate Change and Health, as Dan mentioned. And we have been focusing for about 5 or 6 years now on how electronic waste particularly affect children. Of course, it affects everyone who works on it in the informal sector, the workers as well, but we'll be seeing that some of the toxic effects of these chemicals and these metals are particularly harmful for children, and in a way we really need to protect the future of our societies, so our children. Some of these slides are also available online at the WHO website. On children's environmental health, you'll have the full you'll have the link at the end, and you can request these slides and use them as well. So this is based on some of our training materials. So one of the reasons why we really care about environmental health and children's environmental health is because we know today that 1 out of 4 deaths in children under 5 are due to environmental risk factors that are completely preventable. The same is true for about 26% of the childhood diseases that young children have. They are preventable if we take actions on, if we take environmental actions. Sorry, Dan, I seem to have been blocked. There we go. Sorry. And so when we talk about environment, these are some of the environmental factors that we're really worried about in the areas mostly of air pollution, water sanitation, hygiene and wastes, and chemical factors. Air pollution, of course, being very linked to climate change. But we also have been noticing with some concern that there are emerging environmental health risks for children that are new, and we don't have much information on, or at least we realize that the health sector doesn't see them as a health problem yet. And so this is one of the reasons why we are talking today about electronic waste. So the reasons why we focus on children are mainly 4. It's because we understand that children are not little adults. Many years ago, doctors used to treat children as the same as adults, but today we know they are especially vulnerable, and they have special characteristics that separate them from the rest of the population and actually make them more vulnerable. So these are the 4 main ones that we'll be looking at. First of all, children have their very unique exposure pathways. We know today that the placenta, for example, is no longer a barrier. Certain toxic chemicals and metals that we find in electronic waste can cross the placenta. They are also exposed to some of these chemicals through breastfeeding. They also have higher exposure levels because they put everything in their mouth, their hands all the time in their mouths. They also live closer to the ground, which makes them more exposed to the fumes. For example, mercury is evaporated, especially at lower levels once it's in the ground, and so they can breathe it more easily. And of course, they also do not understand danger. And we know that electronic waste is being recycled in the informal sector many times by teenagers who may not be aware of the future health risks that this presents to them, or they may not care. And we also know that children are also exposed in the informal sector, either through living there or because of working because of their small hands. So exposures can occur to children, can occur either before birth, so throughout the pregnancy, in the infancy, and this can happen because either e-waste recycling is happening in their own homes, in their own communities, or also because the parents, for example, don't change their clothes or don't wash their hands or don't wash their bodies when they come home, and so they come in contact with all these chemicals. As children, again, some of them are working on electronic waste, and others are exposed in the same environment as in infancy, and then in adolescent we have, of course, this many of them work, and so we have this working issue. So I wanted to clarify that we have a lot of chemicals today. Chemicals like to bind to fat, and so they bind to breast milk, and so they can come. Children can be exposed, for example, through the breast milk of the mom. We do, however, in WHO recognize that breast milk is still the best food for a young baby and for an infant. So it shouldn't necessarily be stopped, even though in some situations we do have very high exposure levels. We also know that this affects, even before children are born, it may already affect spermatogenesis in males, so this already has also preconceptional effects, health effects, and also because many of these chemicals, particularly lead, it is deposited in our bones when we are exposed to it. This gets recirculated during pregnancy, which means that it reaches the fetus because it gets released with the calcium. It gets associated with the calcium in our bones, and it gets released again in our bodies when we're pregnant, which means that, again, we can be highly exposed when we are in our mother's womb. And actually, this already builds up our future lead content of the future body. So this may have actually, this is something that can be carried on for generations. Again, we talked about child labor, and I just wanted to remind everyone about the different international labor organization conventions defining what is hazardous work, something that can jeopardize children's physical, mental, or moral health. There is also a basic minimum age for working of 15, and also the tasks that should be performed when you're a teenager shouldn't be tasks that are too heavy, but more kind of light work. And so, again, what we see many times in the informal sector is child labor at its worst. So this is a very old scheme, but I like it very much because it shows that from conception until it goes until the full-term baby, it shows that there's times that we can see here in red when some organs and systems are being developed, and they are particularly vulnerable to chemicals or to metals that may affect them during that time. And we can even see that as time evolves, other organs are being more highly developed. And so this is why we always say it's so important about the timing of exposure, because something may affect something earlier in pregnancy and a different organ system later on in pregnancy. We also have to remember that some of our systems, like the respiratory system and the brain and the brain system, continue to be developed, and the neurological system continue to be developed until about 18 to 20 years of age. So even if we're exposed after we're born or much later in life, these exposures count a lot. We also need to remember that when a child is very small, many of the different systems that they have to get rid of these chemicals that we have completely developed as an adult are not completely in place yet. So they also have more trouble getting rid of some of these toxicants. And the two last reasons why we focus on children so much, and we say they're not little adults when we talk about environment, when we talk about electronic waste, is that they have a longer life expectancy. Some of these components in electronic waste may be cancerogenic, and cancer takes many years to actually, it has a long latency period, and so it may appear much later on in life, even in adult life. So you may not see all the effects immediately like you would see with an injury, for example. And finally, children are politically powerless. We are choosing the world for them. They do not vote, but we know today, especially when we see all these children out in the streets marching on climate change, that they have rights and they want us to protect their rights. And so one of the reasons why I'm so thrilled to be here today is because I hope we can raise enough awareness and actions in the longer term so we won't see them marching in 5 years saying, why haven't you done anything on electronic waste yet? So environmental pollution related to electronic waste may be associated, well, mostly with these primitive practices, these informal practices, so open burning. Many of these materials end up in landfills. We have to remember that waste sites are also, for many children, are their favorite playground. They have so many different waste toys in there and so many things they can do in a waste site. And also because of the ways we recycle, improperly recycle and recover the materials. So we know that we have over 1,000 chemicals in e-waste streams, and some of them are valuable, like gold or copper. Others can pose serious health risks, like heavy metals, the polycyclic aromatic hydrocarbons that are released during burning. Also the PCBs found still in many of the old electrical equipment, brominated flame retardants, polybrominated diphenyl ethers, also some plastic components, and these are just a few examples. So when we look at different e-waste components, and these are just a few, we also see all these different metals that are in there, and many of them, there's also a lot of persistent organic pollutants in there, which is very worrisome because we cannot get rid of these pollutants so easily. They remain in the environment. They remain in our bodies once we're exposed. They remain also, they get attached to the fat of the animals. And so even though some of them have already been addressed by the Stockholm Convention, we still see them around in our environment. So the pollution we're creating today because of bad e-waste recycling may stay with us for many years. So as I said, children may be directly working with electronic waste and so may be exposed to corrosive agents, toxic air particles, also high levels of toxicants at the site. Many of these places where e-waste is being recycled are poorly ventilated. Many times this recycling happens inside the home. I have seen houses where or in slums where they recycle electronic waste where actually the children's rooms themselves are separated by batteries. Often the gardens are non-existent because there's such big waste piles out there just for the constant recycling that they are continually exposed to high risk of injury. And also when we measure the levels of lead, for example, inside the house, they are extremely high. And then even if the family or the children are not directly involved in e-waste recycling, we see that the pollution, many of these components like lead, for example, stay around in the area and they can be there for a long time. So again, children can be exposed just by living near informal e-waste recycling towns. And of course, it's not only the soil that is contaminated, but the air, the water, and also the food. And I mentioned last time, there was this IPEN report last year that mentioned that one of the eggs from the Abogloshi site in Ghana had way higher levels of dioxins than are allowed to be ingested by WHO per day, or than are recommended to be ingested by WHO per day. So this is only one egg. Imagine all the rest of the food that is locally produced. So we worry about children because this is not just a matter of environmental pollution, this is a matter of human health. We often have a report from our collaborating center in Uruguay. It dates of a few years now, but if you look at the town of Montevideo, it has a lot of lead problems, traditional lead problems. And today, 24% of the high elevated blood levels they are seeing in children are actually due to the burning of cables all over town. This leaves like black spots. where children actually just children live around and they live in those areas. And so basically 25% of the high blood levels we have today in Montevideo are due to electronic waste, which is something quite striking. So a few years ago, WHO and WHO collaborating centers worked together on a systematic review to find what were the main health effects due to bad electronic waste recycling. And these are some of the ones we found: problems in thyroid function, in lung function, adverse birth outcomes, decrease in height and weight, problems, behavioral attentions, of course, and DNA damage, which may lead to problems again later on in life. We also know that many of the components in e-waste contain heavy metals and chemicals that are extremely damaging to children's neurodevelopment. And so, in a way, we can once a child has been exposed earlier on in life, I mean, this damage is often irreversible. And so, that child may be able to go to school, receive proper education, but probably his or her IQ has already been diminished, and also neurodevelopment has already been impacted from earlier on. So that learning potential, that thriving potential, that societal potential has already been quite diminished because of these exposures. So we see multiple toxic effects on lead from from e-waste from a systematic review, but also from other more recent literature. And as we mentioned, it can lead to neurodevelopmental deficits, damage to the blood and cardiovascular system, respiratory diseases, skin problems, gastric diseases. And we also know that e-waste workers have very high incidences of birth defects and infant mortality. So what we know so far is that there is evidence of contamination, of exposure. The toxic effects are very important among those who are exposed. There is a very important vulnerability in children, particularly because of what we just saw. And there is also a social vulnerability because people who are working on doing informal electronic waste recycle, they're doing this for a living, and often they don't have another option for an income. The problem is quite similar to what we see in artisanal small-scale gold mining. And so these are populations that are sometimes they don't even have healthcare access. There is a very strong, there are very strong social problems that have to be addressed as well. But we also know there's injuries related to electronic waste dismantling, but there's also a lot of different chemicals, and all these chemicals and metals we have been mentioning come as mixtures. There's many of them in each of these components. They are not always the same, so they create kind of a cocktail effect. So in a way, the effects they may lead to are not just from one component, but from many others, and so they can be additioned and even multiplied. And as we said, they depend a lot on the toxicity of the component, on the dosage, and especially on the timing of the exposure. They may be cumulative, which means that every time you're exposed to lead, your body just accumulates it in your bones and your systems, and they may also have intergenerational effects. And some of these effects may only be seen later on in life, as we said, and have long-term consequences. So now that I have scared you, I have to tell you that this is also a very unique moment. A few years ago, we were discussing the Millennium Development Goals, and it was very difficult to see how health and environment would work together under those. Today, all the countries have taken this commitment to realize the Sustainable Development Goals, and so there is action all over the world for all of us to work together. And I think we often say in WHO our main Sustainable Development Goal is goal number 3, which is the one about health, and we like to think in our department that is not the health goal. That is actually the disease goal. It's the one about vaccinating and curing diseases. And all the health-related goals are everywhere else. And for electronic waste, for example, the one on decreasing chemicals and achieving a sustainable unsound waste management, which are more implied in other goals like number 12, they are there. So I think we have an opportunity today where the world is listening, the world is trying to find solutions to these problems, and we have all realized that we can only do it by working together. So I think we have an opportunity now that we didn't have before. So in order to prevent children being exposed to electronic waste, we also have to work at different levels, as you may imagine, at global level, at national and at local level. For international level, I'm just going to be given a few examples now. And at international level, for example, we have now in the past 10 years, we have a series of World Health Assembly resolutions that have been voted by and accepted by ministers of health. We particularly have one on the role of the health sector in the chemical and waste management, trying to achieve a sound chemical and waste management. So we do have our own audience, the health audience, engaged in addressing these issues. In WHO, we started a few years ago an initiative on electronic waste and child health, and these are the main objectives of this initiative. We basically realized that the world didn't know they had a health problem related to electronic waste, and that we had our part to play as part of what other sectors and other agencies were doing in the context of electronic waste. So these are some of the things that we have been working on in the past few years, which is, one is increasing the evidence and knowledge base, raising awareness and communicating on the health impacts, building the capacity of the health sector to better protect children, and again, to raise their awareness, but also to give them tools with ways in which they can provide good advice and have these children protected. Promote the monitoring of exposures to electronic waste, work with other sectors to implement the right policies, and advance specific research, mostly on the impact of interventions. And I think that health has a really strong role in that, seeing if, for example, if the blood levels decrease after certain interventions, actions or policies are put into place. So this is just to mention. Well, I will mention it after. So anyway, this is going to give just a very few examples of what can the health sector do, what can a healthcare provider do. We believe that the ones best positioned to address this issue work. I mean, of course, we have the ministers of health at national level, but at local level, it's primary health care. It's community workers, community healthcare workers, the people who are working with these affected communities all of the time. We must always remember that doctors, nurses, primary healthcare workers are regarded as are admired and members of society, and they are listened to, and what they say has a lot of weight with the communities, which is why I think when they come with a message about child health, people may not care if you tell them, oh, you are working on this and it's harmful for you. But if you tell them it's harmful for your children, they might listen differently. So these are some of the things that we believe healthcare providers are really well positioned to do. Of course, to promote interventions to reduce electronic waste, to guide surveillance and epidemiological vigilance for some of the illnesses and also some of these exposures, to work closely with the affected communities, to help identify the problems, map the problems. Primary healthcare workers are often walking around and working in the whole community, so they can easily identify where electronic waste recycling is going on. Many of these also visit the mother's home, for example, when the mom has a baby, in order to give advice about breastfeeding, and that's also a unique opportunity to provide advice about other environmental risk factors and to detect if there could be a problem, an e-waste problem in that home, in that neighborhood, then report it back to the local clinic, discuss it with the mayor, with the community authorities. Anyway, so it's really important that they are aware about e-waste as a health problem, and they also identify it and identify the exposures. They can also diagnose the exposures and treat the health effects. They can educate other healthcare professionals. I mean, in an ideal world, this should be a part of what all health-related education and universities should be providing. I mean, awareness about this should be included everywhere it's not there necessarily today, even though the path is being opened. But there's many other opportunities, especially as postgraduate studies or in conferences or in weekly meetings where all of these the issues could be discussed. Again, they need to promote policies for the safe management of e-waste, and these are policies that may be relevant to other sectors. For example, also trying to push for, and that's the final point that I put there. Many of these chemical and waste conventions have been signed by countries, and so they can be listened to and lobby for the actual implementation of these conventions, trying to stop electronic waste being imported illegally, for example. So when we talk also, we could go into more depth in here, and you can go into more depth in the MOOC, but they can also monitor the exposures, as I said, perform monitoring in the workplace and surroundings, use pre and post intervention data to see if policies and actions are working, take advantage of handheld devices. Some of these monitoring, especially biological monitoring that I give examples there, can be very expensive, but other kinds of monitoring, like for example, measuring lead, is quite easily doable, even if the local capacities, lab capacities are not completely into place, and it's not very expensive. So it's a matter of deciding locally with the in each community, in each country, in each place, which is the best way to monitor all these interventions and to be able to monitor as well how exposed communities are. And I think ultimately what is important about monitoring is that, in an ideal world, and this, we should all have, every country should have proper lab equipment to do proper monitoring. So we can already choose the monitoring that we can do. But I think as we advance on electronic waste and on many other chemicals interventions, we hope that labs will be able to meet this, to have the resources to actually be able to perform more monitoring. So these are some of the questions that a healthcare provider, as we said, for example, the primary healthcare worker can ask. These are just a few examples, but there could be others, and they could be adapted to your local situation. And again, I think these questions can be asked also if they're not necessarily targeting e-waste interventions. They could be targeting other kinds of interventions, but if it's got to do, for example, with household air pollution and the fuels being burned in the homes, well, you can just add one or two more questions about electronic waste. We don't want to impose every important theme to the workers, to the primary healthcare workers, but I think the fact that they go and visit the homes could be taken as an opportunity to find solutions for this. So to finalize, I wanted to bring forward a few of the tools and resources we have. We have a WHO training package on children's environmental health for doctors and nurses, which are full sets of PowerPoints with notes and references that everyone can choose from and adapt to their own context. We do have one on electronic waste, we have one on lead, we have one on mercury, we have one on how to take a pediatric environmental history. This MOOC is really important because this MOOC really gives so many different solutions to this problem and really looks at it in a much more holistic way. We also have technical information, so as I said, a systematic review that we're updating, and also a series of publications in the literature on child health and electronic waste. We also have a Children's Environmental Health Atlas, a WHO one that was published 2 years ago, and one of the chapters is on electronic waste. And then we will soon have, in a couple of months, we will have the first WHO book on e-waste and child health, where we will be looking at many of the things we discussed today, the way children are exposed, the health effects that we found in the literature, and also which are the different actions at different levels that can be taken by the health sector, which is WHO's main audience. And we will also have for the first time a small child health chapter on the upcoming global e-waste monitor that is being published, I think, in April. And so part of our mission is also to disseminate information. So we do this through a different WHO channels, be it Twitter, being newsletters for the more traditional ones, our websites, and we also try to take every opportunity that we have whenever we have a child health conference to bring this issue forward. We were also hoping to maybe have an event on a future World Health Assembly, if this is so requested by member states. This one is, with the coronavirus, it's going to be difficult, I think, to get to this one, but we hope soon to be able to raise even greater awareness between the ministries of health, both with this book, with our actions, and also hopefully in one of the future assemblies. Anyway, so yeah, so our next steps is to continue communicating. We are now also part of a global electronic waste coalition that is being formed between 10 United Nations agencies and organisms, including Basel Convention, who is here. And we are all trying to work at global level to continue raising awareness, creating an evidence base, creating capacities like this MOOC, for example, but also to start working locally. And for that, we joined forces with UNIDO a couple of years ago, and we'll soon be starting our first child health pilot in 2 countries in the Americas as part of a bigger project that they have. And we also hope that as part of this bigger e-waste coalition, we should ideally be able to start country interventions as well between the 10 different UN agencies, hopefully in Africa. But yes, this is still under decision, but we really want to raise the awareness at international level and communicate on this, but at the same time, really take this issue to the countries so they can find solutions for this. And that's the end of it for me. So I invite you all to join this MOOC. I have reminded everyone of the link to the massive online course, and also our website where you can find a lot of the materials that I mentioned. And yes, I really hope that we can all keep working together to protect our children, and to protect their health. Thank you very much.